Today's World AIDS Day, a day where people come together in solidarity to show their support for the more than 34 million people living with the virus worldwide. In the U.S., approximately 1.2 million folks are currently living with HIV. Great strides have been made in the prevention and treatment of the virus. In the last decade, there has been a 20% overall decline in the number of diagnoses in the U.S., according to the Centers for Disease Control and Prevention. But among gay, black, and Latino men, the stats are distressing. Gay, black, and Latino men are the most severely affected group, who've seen a 6% increase in new diagnoses over the past decade. The steepest increases are among young, gay, black, and Latino men aged 13 to 24. They've seen an 87% increase. The CDC projects that 1 in 6 gay men are at risk of being diagnosed with HIV in their lifetime. For black gay men overall, 1 in 2 are at risk. For Latino men, 1 in 4 could contract HIV. Joining us to discuss this is Terrance, the Deputy Executive Director of the National Association of State and Territorial AIDS Directors. And also here on our panel, John Burnett, Carmen Berkeley, and Dr. Chris Metzler. We discussed this earlier this year, and I said then, where are black gay organizations in terms of rising up and demanding resources be diverted? Mm-hmm. Because the reality is this here, and that is these resources are still going to largely white, gay organizations and bypassing those who are most at need. That report was dropped, I think it was in February or so. What has happened in the past 9 months?
Well, first of all, thanks for having me today. And this is a really distressing topic that I'm really happy that there's a national platform to have these conversations. Over the last 8 years or so, we have really seen a rise in terms of us having conversations about this movement, and particularly around this population of men who are severely impacted. There have been lots of resources that have been pumped into communities and to governmental public health. It's not enough. There's more that needs to be done. There are more efforts in terms of empowerment that need to happen. But as you mentioned before, this is a staggering statistic. The notion that in one's lifetime, if you are black and gay, that you are more than 50% likely to contract HIV is disturbing. But we do believe that there are some opportunities, and particularly around how we might be able to better work with the healthcare industry, doctors, nurses around the country, and to really get at what we all know as implicit bias. And this concept of implicit bias, and I say it's a concept, but I believe it's real. It's stereotypes, it is actions, and these are all things that get in the way of people making sound decisions and helping individuals in terms of getting high quality, affirming health care.
But what about where's the rising up? Where is that actually taking place? Because if I'm looking at these numbers, I would expect holy hell to be raised right. From the most affected communities. Mm-hmm. And again, we had a couple of segments on this earlier in the year, and it's amazing how I have not seen mm-hmm. that level of outrage saying this has to be addressed. Mm-hmm.
There has been a lot of outrage. So there are a variety of organizations that have been working over the last few years, and particularly, I want to call out the National Black Gay Men's Advocacy Coalition that has really worked to convene a cadre of black gay men around the country to really demand resources to be put into these communities, both in terms of HIV prevention efforts and also HIV care and treatment for this patient population. We, in my organization, have spent the last 2 years working on what we believe is a groundbreaking project, the first of its kind, an accredited set of tools for doctors and nurses. It's called His Health. It's housed on hishealth.org, that works to train doctors and nurses around this concept of implicit bias so that they can work through all of their issues to help to provide better care to this patient community.
So, I know that with the, with PrEP,
right.
with the medication that, helps people prevent HIV, have you seen an uptick in the usage of PrEP within the African American community?
That is an excellent question as well. I mean, it's a disturbing statistic here. There's a data point that I wanted to share. So 1 in 3 doctors are unaware of PrEP. or pre-exposure prophylaxis. And that is a medication that you can take daily to essentially prevent HIV infection for those who are HIV negative. So think about that for a second. 2/3 of doctors in the United States of America are unaware of a life-saving medication in 2016 that could prevent HIV infection.
Who's the manufacturer of that drug?
And so there's a lot of work that needs to be done on that front in terms of getting doctors, nurses sort of aware of this new prevention tool, and to ensure that African Americans, particularly African American gay men, are starting to utilize that.
Yeah, another good strategy would be to work with the pharmaceutical producer of that drug to go into the highly infected areas, right, or densely populated areas that have a high concentration of infected black men, and also work with those doctors to educate them from the pharmaceutical perspective.
But public pressure is to be applied to that, just like what
Absolutely.
happened with the EpiPen. Bottom line is, when that level of public pressure was applied, that's actually how there was some movement.
Right.
Right.
And, you know, I want to mention
About 30 seconds, go ahead.
On hishealth.org, you talked about PrEP. There are a variety of modules that I want to highlight for folks. Doctors can go online and they can learn about this new prevention tool. They can learn about how to link and retain individuals in medical care. They can learn how to take a sexual health risk tool assessment. And so these are all important, basic, fundamental things that need to happen. And so we're looking forward to engaging as many doctors and nurses as possible around the country.
All right. Well, we certainly appreciate it. Thank you so very much.
Thanks for having me.
All right, folks. We come back. 60 seconds right here, NewsOne Now on TV1, our What the Hell segment. Thanks a bunch to Carmen, John, and Chris as well. Be back in a moment.